So first visit's always 30 minutes. We sit down, paperwork, go over, I talk face to face. I've already looked at their paperwork, probably, if not, if they haven't looked at it, done it in the office. But I ask them to tell me what they're coming in for in their own words. If I haven't read it on a piece of paper already, ask them, what they do, what their normal thing is, what's their goals. Have they ever been to a chiropractor before? Traumas, surgeries, etc. I don't do x-rays in the office, but I love x-rays. I love looking at them. I tell people, if you've had recent x-rays, let me take a look, bring them with you, send them to me before so I can get an idea of what their spine looks like. And then first adjustment is, we go through the exam. I look at their posture. I look at their palpation. I put my hands on them. I see what I feel based on that and what they've told me and what I've seen. Most of the time, it's an issue I've dealt with on somebody before, so I kind of know what to think about and what to talk about with them. I do adjust them on the first visit. But I always say at the end of that first adjustment, which I'm not trying to fix them that day, and I'm really not trying to fix them ever. I'm trying to, facilitate their healing to 100% versus like thinking of their body as fixed or broken. It just doesn't work like that. So I try to get them out of that sort of paradigm a little bit, but I tell them that the second visit's more important than any of the other ones, because I'm not going to tell them day one, first visit, you need to come twice a week for 6 months or once a week for, or once a month for, I don't tell them any of that, because I want to see how that adjustment holds between that day and their next visit, which is usually in a couple days. I try to get them within a week, ideally within 3 or 4 days, just to see how you feel. You felt better? Great. You felt worse? Maybe good, right? Different, the same, whatever. And then on that second visit, we figure out package or, like consistency, etc. Because there's so much that goes into it. I would much rather you are a patient for life because I told you the truth versus get you to come 3 times a week for a month and never see you again. And maybe I oversold you and that was like not what you needed. It's just like, I think it always comes out in the wash. What I love about having Dan in the office too, and especially in the corporate idea, is like, I never used to really talk about nutrition too much. My nutrition talk was like garbage in, garbage out, which I still think is actually true, right? But I love having Dan here to sort of be like, listen, there's inflammation. Like what you've told me, like there's a lot more going on than just like a musculoskeletal issue. Talk to Dan. We need to figure out this inflammation issue too, or you're overweight, or maybe you're underweight, whatever it is, right? Like you're older and you're not working out, your bone density, like you need to start, and people feel scared about that. They feel like they're too weak to start working out, they're too old. So I love having like another voice to kind of be like, and you need to speak with him because there's more than just me adjusting you once a week that's going to change you.